Should you have contrast for a diverticulitis quart scan? When doctors suspect you might have diverticulitis, they often order a quart scan to see inside your abdomen. One common question is whether this scan should include contrast material. Let's explore what that means and what the current medical guidelines suggest. A quart scan uses X-ray technology to produce detailed images of your internal organs. Contrast materials are special substances that help highlight specific areas on these images. They can be given in 3 ways: by mouth, through the rectum, or injected into a vein. For diverticulitis, the main focus is usually on intravenous contrast, which is injected into a vein. Research and expert consensus show that for uncomplicated diverticulitis, a quart scan without contrast can often provide enough information. These scans can reveal inflammation, swelling, or abscesses that are typical signs of diverticulitis. In many cases, adding contrast does not significantly improve the accuracy of diagnosis. However, intravenous contrast can be very helpful if there is concern about complications like abscesses or perforations, or if the diagnosis is uncertain. It can make it easier for radiologists to see details and distinguish diverticulitis from other causes of abdominal pain. Oral and rectal contrast are less commonly used today. While some older studies suggested they might improve detection, recent evidence indicates that scans with just intravenous contrast are usually sufficient. Adding oral or rectal contrast might be considered in special situations, such as if intravenous contrast cannot be used because of allergies or kidney issues. But generally, they are not part of routine testing for diverticulitis. The decision to use contrast depends on your health history, the severity of your symptoms, and your doctor's judgment. For example, if you have kidney problems, your doctor might avoid intravenous contrast to prevent kidney damage. If you have allergies to contrast agents, alternative imaging options might be considered. The goal is to get the most accurate diagnosis with the least risk. In summary, most people with suspected diverticulitis will have a quart scan with intravenous contrast because it provides the clearest images, especially if complications are suspected. But in many cases, a scan without contrast can still be effective. The choice is made based on your individual health and the clinical situation. Always trust your healthcare provider to determine the best approach for you. If you experience symptoms like abdominal pain, fever, or changes in bowel habits, seek medical care promptly. Only a healthcare professional can decide the most appropriate imaging method for your specific case. Remember, accurate diagnosis and personalized care are key to managing diverticulitis safely and effectively.